So the GIMEMA CLARITY study is an observational study sponsored by the GIMEMA Foundation. This study enrolled more than 500 patients across Italy and UK, and its main objective was to assess the health-related quality of life of patients with relapsed refractory multiple myeloma, and to examine the prognostic value of patient-reported outcomes for survival. Okay, so for this, for the data that I will present the EHA, we conducted a secondary analysis for this study, which with the main objective of assessing the association between the socio-economic inequalities and the health-related quality of life. So for each of the patients enrolled in this study, we assessed their socio-economic status based on the information from three variables that are the level of education, the employment status, and the living arrangement, so if the patient lived alone or not. So based on this, we classify the patients into three categories of socioeconomic status, and then we evaluate their quality of life. Patients at the time of study entry had to complete a set of patient-reported outcome measures, so which they assessed a set of symptoms, functional aspect, and their quality of life. So we generally observe that patients with a low socioeconomic status reported worse quality of life outcomes with respect to patients with a middle or higher socioeconomic. Okay, so we did not examine the exact mechanism behind these differences, but we could just speculate based on the existing literature, which could be the possible explanation of these differences. For example, many studies have suggested that these inequalities in quality of life may persist also in countries like Italy or UK, where there is a universal healthcare system, because in general patients with a lower socioeconomic status are also patients with lower resources, like for example money or knowledge, that can be very helpful at the time of affording a disease or a treatment. For example, just to make an example, patient with a lower economic resources may have more difficulty in affording the payment for supportive treatment or for managing treatment toxicity like pain. And we, for example, observe that patients with a low socioeconomic status have a higher prevalence of clinically important pain with respect to the higher socioeconomic status. So this could be a possible explanation. Other explanation could be that patients with a lower socioeconomic status are more likely to adopt unhealthy behaviors that are linked to a low quality of life. So of course we would need more studies to investigate in detail which are the exact mechanism behind these inequalities in this specific context of relapsed refractory multiple myeloma, but this could be just an hypothesis based on the literature. In order to assess this problem and to manage, try to minimize the inequalities, it's important to implement multi-level approaches that involve multiple actors. For example, from the point of view of researchers, it's important to try to start standardizing the way we measure these inequalities and the social determinants of health, because there are many indicators that usually are assessed differently from study to study. And also it is important to try to screen this patient and to try to identify which are the most vulnerable population in this respect, not only in clinical trials but also in clinical practice, in order to better identify which can be the population that can benefit most from this specific intervention. And of course it is important then to assess their unmet needs and try to design and specific intervention aimed at minimize these inequalities.